Well, I think one of the things that I'm hearing is about the proliferation of high deductible plans. I mean, that's really where I think there's been more discussion that I've heard. And of course, this is being blamed on Obamacare. But when we think about benefit design and we think about the metals and we think about the what employers are doing with high deductible plans, is there a point where too high is too much?
Yeah, well, I'd say for many of those who are in the exchanges, you're already at that point, Dennis. It is too much, and I think if you look at that average out-of-pocket spend, if you compare, if you look at the totality of both the premium payment as well as the expected out-of-pocket in terms of deductibles and co-insurance, it's consuming far more of their total family income than is reasonable. So it's a dilemma, right? Because you can't. It's the only way to have premium plans at an affordable premium, but the reality is that the totality makes it completely unaffordable. So the only way out is, as Art mentioned, finding collectively a way to decrease the costs of delivering the care, and narrow networks for many of is a way of doing it, Ateev, as you know. Until we see, I think, the full effects of the transformation of the industry, we're in a quandary, and it's not going to get better. And unfortunately, I'd say states like New York that have these mandated benefits, layers of regulations, make it even harder on people, because it's I think that's why you're not seeing the young invincibles, because it's very expensive.
Yes.
And
well, I'm not here to argue in favor of more regulation.
No. Yeah.
I think we should have more regulation of health plans. I think that's a great idea. That's what Art said, right?
But I will tell you this. It's very popular to argue against mandates of any kind. But I would have to say that if somebody struggles to pay their premiums, their insurance should mean something. There should be a minimum benefit package that insurance covers. And in New York State, they have been in the forefront with making sure. I can tell you as a surgeon, when I used to see people from out of state with insurance, it was shocking to those patients sometimes how little their insurance really meant. And at least in New York State with those mandates, and now nationwide with minimum benefit packages, now if somebody has insurance, it actually means something.
Yeah, but it's still expensive.
It is
I think
expensive.
That's the point, right? I mean, we got to find a way to attack the core issue, which is you can have a marketplace, you can have any number of plans on them, but if the premiums are high, or the combination of the premiums and the out-of-pocket represent 20 to 30% of your family's income, that's not affordable.
I think we should be conscious that there is probably, when we have such large out-of-pocket costs for patients, for those who are older, those who are poorer, those who have chronic illnesses, this is likely to have negative health consequences. They're going to have that. And I think that one of my concerns is this distinction between first dollar and last dollar. And right now, what we're asking the average American who has an exchange plan, is to pay the first $2,000, $3,000, $4,000 out of pocket. And I don't know if that makes a lot of sense for insurance design. And going way back to the beginning of our conversation about price transparency, maybe it should be last dollar. So that you should have a reference price that if you want to see, here we'll reimburse for you perform thyroid surgeries. We'll give you X dollars for a thyroid surgery. But if you want to go see someone else whose higher cost, you have to pay for that last dollar out of your pocket. And I think that makes a lot more sense to me for me, as a better insurance design, given the price variation we're observing, as opposed to so much focus on first dollar. And so some combination of that. I'm hopeful that we're going to see more of a shift towards in that direction.
Yep. I can't argue against it. I haven't really thought that one through. But I would also tell you this. When someone goes on the exchange and gets one of the exchange products through an insurer, and I'm not just talking about our company, but any company, they also do get the added advantage of all the negotiated discounts. So someone who was previously uninsured and broke their arm and it would cost $5,000 in an emergency room, now they get that negotiated price of $2,500, for example. So there is that there too. it's still way too expensive. And we've got to find ways to bring healthcare costs down. And virtually everything we've talked about here today are various ways to try and tackle that, whether it's medications or reimbursement to physicians or having ACOs where there's risk, and so now the burden is on them to find ways to hold down costs. But that's really what this is all about, is making healthcare affordable, getting value, but still maintaining quality.
Well, and in some cases,